Good evening. My name is Chelsea Clark. I am the Assistant Director at Conewago, Indiana, and I am going to be the one providing this presentation this evening. So I want to welcome you for joining. This presentation focuses on understanding addiction and the relationship with mental health. So addiction involves craving something intensely when you have a loss of control over something and continue involvement despite the adverse consequences. Addiction is a complex brain disease that causes the inability to stop using a substance or engaging in a behavior, even though it's causing psychological and physical harm. Addiction causes a person to often struggle to control their behaviors. They have strong cravings. They often struggle with emotional responses, and they have the ability to abstain from using. People can become addicted to a variety of things to include alcohol, drugs, shopping, food, sex, pornography, video games, and also gambling. Nearly 23 million Americans, that's almost 1 in 10, are addicted to alcohol or some other form of substances. More than 2/3 of people addicted with have an addiction issue, they're often abusing alcohol. The top 3 drugs causing addiction issues are marijuana, opioids, or cocaine. Addiction is now understood to be a brain disease. Whether it's alcohol, prescription pain pills, nicotine, gambling, overcoming addiction isn't as simple as just stopping exercising or gaining greater control over those impulses. This is what is impacted when you hear about the reward systems or our pathways. One of the significant parts of the brain is the reward system. And this is developed as a way to reinforce behaviors we need to survive, such as eating. So when we eat foods, the reward pathways activate a chemical called dopamine, which in turn releases a jolt of satisfaction. So we're happy then. This encourages you to eat again in the future. When a person develops an addiction to a substance, it's because the brain has started to change. This happens because addictive substances trigger an outsized response when they reach the brain. Instead of a simple pleasurable surge of dopamine, many drugs of abuse such as opioids, cocaine, or nicotine cause that dopamine to flood the reward pathway 10 times more than a natural reward. This happens because addiction develops when the pleasure circuits in the brain get overwhelmed in a way that become chronic and also sometimes even permanent. So there are some risk factors and protective factors when it comes to addiction. So risk factors are those negative influences in our lives of the individuals or community. These increase the presence of crime, victimization, fear in a community, and they may also increase the likelihood of individuals engaging in crime or becoming victimized. Now, protective factors, they can improve the lives of individuals or the safety of the community. They may decrease the likelihood that individuals engage in crime or become victims. So some examples of protective factors are high self-esteem, religion, peer factors, so a good peer group or a good bond with your family or a good positive support system, having self-control over oneself, parental monitoring for someone who's younger, academic competence, or a strong neighborhood attachment, so a good bond with the community in your neighborhood. So some risk factors that are related to addictive behavior are when there's a family history of addiction, when there's a mental health diagnosis, peer pressure, that's a big one. They're peer pressured into trying something. When there's a lack of family involvement, so when that social family bond is no longer present, or anxiety, depression, and loneliness. So mental health problems and substance use disorders sometimes occur together. This is because certain illegal drugs can cause people with an addiction to experience one or more symptoms of a mental health diagnosis. Mental health and substance use disorders share some underlying causes, which include changes in brain composition, genetic vulnerabilities, or early exposure to stress or trauma. More than 1 in 4 adults living with serious mental health problems also have a substance use disorder. Substance use problems occur more frequently with certain mental health problems such as depression, anxiety, schizophrenia, or personality disorders. Certain mental health diagnoses are established risk factors for developing a substance use disorder. So it's often hypothesized that individuals with severe, mild, or even subclinical mental health disorders may use drugs as a form of self-medication. So self-medication refers to the misuse of drugs or alcohol in an attempt to manage the distressing symptoms of a mental health disorder or other conditions. So individuals, there's many different types of mental health disorders. We have anxiety, mood, psychotic, eating, personality, obsessive compulsive disorders, also known as OCD, or post-traumatic stress disorders, also known as PTSD. So individuals with anxiety disorders respond to certain objects or situations with fear and dread, as well as with physical signs of anxiety or panic, such as a rapid heartbeat or sweating. An anxiety disorder is diagnosed if the person's response is not appropriate for the situation. So that's when if a person cannot control the response or if the anxiety interferes with normal functioning or normal day-to-day activities. Mood disorders involve those persistent feelings of feeling sad or feeling overly happy or fluctuations from extreme happiness to sadness. So this is when our mood changes drastically from being happy to sad, mad to happy, just wide ranges on the spectrum. Psychotic disorders involve distorted awareness and thinking. Two of the most common symptoms are hallucinations. Hallucinations are the experiences of images or the sounds that are not real, such as hearing voices. And delusions are false fixed beliefs that the individual accepts as true, despite the evidence that it's not true. Eating disorders are a serious, complex mental health illness that affects one's emotional and physical health. People with eating disorders develop an unhealthy relationship with food, their weight, or appearance. Approximately 20 million girls and women and 10 million men and boys in America have an eating disorder. Eating disorders are caused by several complex factors such as genetics, brain biology, personality, cultural, and social ideas about mental health. Personality disorder is a mental health condition that involves long-lasting, all-encompassing, disruptive patterns of thinking, behavior, mood, and relating to others. These patterns cause a person significant distress, or they impair their ability to function. There are 10 types of personality disorders, each with different characteristics and symptoms. Personality is vital to defining who we are as individuals, so that makes us who we are. It involves a unique blend of traits, including attitudes, thoughts, and behaviors, as well as how we express these traits in our interactions with others and with the world around us. Personality disorders may cause distorted perceptions of reality, abnormal behaviors, and distress across various aspects of life, including work, relationships, and social functioning. Additionally, people with a personality disorder may not recognize their troubling behaviors or the negative effect they have on others. Next is OCD, obsessive compulsive disorders. And this is a mental health diagnosis that causes anxiety. People with OCD have uncontrollable obsessions. They try to lessen anxiety with repetition, called compulsions. OCD causes distress and does interfere with normal life. Cognitive behavioral therapy and medications may help with this disorder. Post-traumatic stress disorder is a mental health issue that may develop after a traumatic event. It causes negative and anxious emotions. Some people with PTSD relive the event over and over. Others avoid any reminders of it. PTSD interferes with life, work, and relationships, but medication and counseling can help even years down the road. Family members are often desperately concerned about a loved one's drug or alcohol use, but don't know how to begin the conversation about addiction. For many people struggling with addiction, they are often motivated to seek treatment by the care and concern of their loved one. It is important for family members to push through any discomfort they may have about initiating a dialogue about their loved one's substance use. It's important to be supportive, non-judgmental, and to be specific about behavioral patterns you have observed. Be prepared to offer help. Substance use affects everyone in the family, so it's important that family members are involved in the treatment and recovery process of adults and youth. Self-fulfilling prophecies are real. If you believe in someone, they are more likely to succeed. If you doubt them, they're more likely to fail. The challenges facing you might seem overwhelming, but the benefits of helping an individual with addiction to live in recovery far outweigh the cost for you, for them, and for society. You may have to adjust your lifestyle to help your loved one's recovery along. If they live with you, eliminating medicines from the home, removing reminders of their addiction, and providing healthy opportunities may be necessary. You learn that you have contributed to the betterment of someone you love. Not everyone can say they have helped someone save a life. You will learn more about yourself and your loved one than you thought possible. Every individual is different, and situations vary greatly. The person may have a specific diagnosis, or you may just have concerns about the way a person has been talking and behaving. You guys know your loved ones the best and may have an understanding of what approach or support will be most helpful. There's not a one-size-fits-all for this. Relapses occur and are part of recovery. Do not lose faith in your loved one just because they use again. Support them and give them the direction they need. You cannot stop anyone from using any more than you can force them to start using. Accept that and be there for them. It's all you can really do. Your responsibility to yourself takes priority. You cannot help anyone if you're unable to take care of yourself. You have to put yourself first, no matter what. One of the hardest and most important steps may be just starting the conversation. You do not have to be an expert or to have the answers to the questions. Express your concerns and willingness to listen and be there for that person. Don't be afraid to talk to them about it. Reassure them that you care about them and are there for them. Try to show patience and caring and try not to be judgmental of your thoughts or actions. Listen. Don't disregard or challenge those person's feelings. Encourage them to talk with a mental health care provider or with their primary care physician if that would be more comfortable for them. For some people, it may be more helpful to compare the situation to physical health concerns and how they would respond. Educate yourself. The more you understand about conditions, symptoms, possible treatments, and what to expect, the better you'll be able to support your loved one. So one of the biggest components when working with someone who's in addiction, or even as the professional or as the family member, self-care is really essential. And there's different components of self-care to include emotional, physical, spiritual, or social. So that emotional self-care, it's when someone's working through those negative and positive emotions in a constructive way. So that's when you can encourage journaling or attending therapy or counseling sessions. So someone's able to display how they're feeling to someone else or put their thoughts to paper. Next is physical self-care. And so that's when you are having your body release energy and stress. So that could be walking in the woods, going to the gym, attending a yoga class, any sort of physical activity. Next, we have spiritual self-care. And that gets one in touch with core values and a deeper sense of what those really mean. So this can really be meditation or attending a religious service. And then the last form of self-care is social. So this allows one to connect with others and maintain a sense of shared human experience. So this is when you can spend time with close friends, attend an outside event outside the home, like an NA or AA meeting. And there are different treatment options as well. And at facilities, we focus on cognitive behavioral therapy, that's CBT, motivational interviewing, group therapy, 12-step programs, and medication-assisted treatment. So cognitive behavioral therapy helps people to develop alternative ways of thinking and behaving, which aims to reduce their psychological distress. So this is when we start to change that brain development and challenge one's thought process, which in turn can help with behavioral outcomes. Next, we have motivational interviewing, and this is very client-centered. And this is for individuals who have mixed feelings about changing their behavior. So we use motivation as a technique. We also have group therapy, and this is often focused around a particular topic. We have positive thinking groups. We have trauma-informed care. We have co-occurring. So this is focusing on mental health and drug and alcohol. We have life skills. We have clinical specialty groups, and this is where we can bring in any topic from work programs to communication to something fun to build teamwork or leadership. Then we have the 12-step programs. This is where they do in-house meetings for NA or AA. This is led by the clients themselves. And then medication-assisted treatment. This is where medications is used in conjunction with counseling to provide a whole patient approach. So there's different options to include Vivitrol, Sublocade, Suboxone, Methadone. Within Firetree as a whole, there are different types of programs to include residential. So that's our inpatient treatment. There are halfway houses. That is the step after residential treatment. There's outpatient treatment providers, and there's residential reentry programs as well. And these are some resources for family members. This is the Firetree phone number and the website, SAMHSA's National Helpline phone number, Alcoholics Anonymous's website, and Narcotics Anonymous website. That is all for the presentation. So if there are any questions, we can take them now. Okay, I don't see any questions in the chat box or in the Q&A section. So I want to thank you for joining this evening, and we will be hosting another one next month, probably around the same time, but we'll be sure to get that announcement out. If you have any questions, comments, please feel free to reach out to us, and we'll be more than happy to provide you with some information. Thank you.